The pandemic is not over in communities with low vaccination rates. The SARS-CoV-2 virus is circulating in every Oregon community, but it is spreading fastest in counties with low vaccination rates. In counties with high vaccination rates, the virus is struggling to sustain itself. Today, Umatilla County reported 70 cases and had a test positivity rate of 14.2%. Jackson County reported 63 cases with a test positivity rate of 17%. Umatilla County's one-dose vaccination rate is 43%. For Jackson County, it's 54%. In contrast, much larger Washington County reported 43 cases with a positivity rate of 4.1%. In Washington County, 75% of residents have received at least one dose of an effective COVID vaccine. Third, at this time, a localized pandemic demands effective localized public health interventions, not a statewide response. OHA stands ready to help local leaders and local public health officials in places where COVID-19 is running rampant due to low vaccination rates. I've been having conversations with a number of local officials. I urge local leaders in counties with high infection rates, high test positivity rates, and low vaccination rates to take action now. As we've learned with previous COVID-19 waves, the sooner we employ effective interventions, the sooner we can flatten the curve, prevent new infections, avoid more hospitalizations, and save many lives. If you're a local leader in a low vaccination county, encourage people who are unvaccinated to get immunized. Promote local vaccination events. Work with your local businesses to help their workers get vaccinated. Call on residents to wear masks in indoor public spaces. Encourage people who are unvaccinated to avoid social gatherings. Let's take a closer look at where our state and counties stand in both vaccination and infection rates. At the state level, Oregon has vaccinated 71% of adults, according to the CDC. That's about 2,380,000 people who've received at least a first dose. In Oregon, 60% of our total population are now vaccinated with at least one dose, which puts us 18th in the country for that metric. Oregon remains 12th in the nation at 55% of our total population who are fully vaccinated. We're continuing to expand our vaccination campaign, including new messages featuring younger adults of color that you'll see during the Olympics. We're working with community partners to reach more people of color. We're standing up canvassers who can go door to door in more populous parts of the state to answer vaccination questions and connect people to local vaccination clinics. But the picture is more complicated at the county level. Across Oregon, counties have vaccinated between 37% and 75% of their populations. Low county vaccination rates have a direct correlation with higher COVID-19 infection rates. Over the past week, case rates in 15 counties exceeded the statewide average of 44.9 cases per 100,000 population. All 15 counties had vaccination rates of lower than 55% for the total population, and 13 of the 15 had rates lower than 47%. Let's look at how this dynamic plays out across all counties. This scatter plot shows Oregon counties by case rate and vaccination rate. Vaccination rate is on the y-axis, case rate is on the x-axis. Counties that have both high vaccination rates and low case rates are in the upper left quadrant. Counties that have high case rates and low vaccination rates are in the lower right quadrant. As you can see, counties with low vaccination rates are all counties with the highest infection rates. Counties with high vaccination rates are almost entirely counties with low infection rates. It's that stark. It's that simple. This graph also shows why we need local county officials to take action. This latest wave of COVID-19, supercharged by the Delta variant and fueled by vulnerable and unvaccinated Oregonians, is not a statewide challenge right now. We needed a statewide response at the outset of the pandemic and over the following months when we had no effective way to combat COVID-19 except for social distancing and masks. The emergency measures Governor Brown put in place worked. They saved more than 4,000 lives. Oregon has the 5th lowest COVID-19 death rate in the country. Then we received first safe, effective, and free COVID-19 vaccines. While it took several months to vaccinate a critical mass of 70% of adult Oregonians, the vaccines allowed Oregon to reopen. But the virus has evolved, and it now poses an even greater threat to the unvaccinated, the Delta variant. And that threat is concentrated among unvaccinated people living in low vaccination counties. As I heard a health officer say earlier this week, if you're not vaccinated and you live in a community where vaccination rates are low, it's not a question of whether you'll get COVID-19. It's only a question of when. So once again, my message to county leaders with high infection and low vaccination rates is take action now. Urge residents in your communities to get vaccinated. Urge people to wear masks. Tell people who are unvaccinated to avoid social gatherings. OHA stands ready to help. We'll send you more vaccine doses. We can help with case investigators and contact tracers. We can get you more testing. We're eager to work with you to schedule more vaccine clinics and conduct outreach in your communities. With that, let me turn it over to Dr. Seidlinger, who can tell you more about the Delta variant and the risks it poses to unvaccinated people in Oregon. Doctor?
Thank you, Director Allen. Let me begin today by providing an update on the pandemic, then speak briefly about the increasing presence of the Delta variant and the risk it poses, especially to unvaccinated Oregonians. At our last media availability about a month ago, I reported that daily cases of COVID-19 related hospitalizations, and the percentage of people testing positive all were in steady decline. But over the past several weeks, all three of those indicators have reversed course. We are seeing steep increases in daily cases and hospitalizations, even higher than the projection in our latest modeling report. And that further contrasts the two pandemics here in Oregon. One pandemic is subsiding for the more than 2.4 million Oregonians who have received the COVID-19 vaccine. You can move about freely without a mask. You don't need to worry about attending gatherings. You have excellent protection against severe disease and good protection against getting sick from COVID. Thank you for taking the step to protect yourself and your loved ones. But for the remaining Oregonians, especially those in communities where vaccinations are lagging, the resurging virus still looms large. This is especially true with the rise of variants that are more easily transmissible. You remain vulnerable to getting seriously ill or passing the virus to someone who might wind up in the hospital or dying. The science supports and our data shows that if you are fully vaccinated, you can have confidence that a get-together with friends or a day at work alongside others won't put you at high risk to contract or pass COVID-19 to others. I thank all of you who have made that decision and taken that step to protect your families, your loved ones, and communities. If you are a parent with young children not yet eligible to be vaccinated, or have others in your house not protected from vaccines, you may still make different choices to protect them, such as limiting gatherings or continuing to wear a mask. People who have not been vaccinated or only recently been vaccinated cannot yet safely enjoy a backyard barbecue, attend a wedding, attend a sporting event without wearing a mask and keeping distance for fear of infection. My message today is to people who have not yet been vaccinated. You are in harm's way. Here are the alarming details. On July 1st, our 7-day average of cases was 181 per day, which represented a 45% drop from the previous month. Now, only 3 weeks later, that average more than doubled to 378 daily cases. Less than a month ago, on June 30th, OHA reported 1,371 new daily cases of COVID, the lowest weekly case count in more than a year. Yesterday, OHA reported 2,026 weekly cases of COVID, a staggering 48% increase. We are seeing the same troubling trajectory for COVID-19 related hospitalizations, a pattern that could lead to the statewide impacts on patient care we experienced last fall and winter. On July 9th, there were 99 people with COVID-19 related illness in Oregon's hospitals. Today, there are 169, a 70% increase. Over the same time period, the number of COVID-19 patients filling intensive care units increased by 19%. There are 38% more ICU patients since just July 1st. More people are also testing positive for COVID-19. On July 1, the rate of percent positivity was 2.9%, which represented a 40% decline from the previous month. Now, just 3 weeks later, that rate is 4.9%, a 70% increase. Earlier this month, OHA posted the latest report on breakthrough cases amongst people who are vaccinated. The report found that 92% of the 7,241 COVID-19 cases reported in June were among people who were either not fully vaccinated. More than 9 out of 10 people who had died with a death associated with COVID that month were also not fully vaccinated. Against that discouraging backdrop, we are seeing a sudden spike in the Delta variant. At present, we have tracked nearly 3,000 cases involving variants of concern here in Oregon. As this slide shows, sequenced cases of the Delta variant have increased from 30% to 50% in the most recent week. This last week shown on the slide shows all Delta variants, but this is very recent data, and this data will likely fill in with additional data. But Delta is now the dominant variant circulating in Oregon, and we expect to see a continued increase of the variant in the coming weeks. This is after the 10-fold increase over the past 2 weeks. And the emergence of this highly contagious variant should be a red alert to those who remain unvaccinated. You are at higher risk now than you were earlier in the pandemic, and you are putting the people around you at risk. That is why it's recommended that people who are not fully vaccinated continue to practice public health interventions, such as wearing a mask indoors and in outdoor crowded settings, so they can protect themselves and their loved ones from COVID-19 when they return home. The best protection against contracting the virus is getting vaccinated. The COVID-19 vaccines are safe and effective. They were exhaustively tested in clinical trials, and that efficacy is reflected in the data here in Oregon. Oregonians have shown amazing resilience over the past year and a half. Thank you to everyone who has helped fight back against this virus in Oregon over the last year and a half, but our fight is not over. My thoughts go out to everyone mourning the loss of a loved one or still fighting the effects of COVID-19 after an infection. I urge all Oregonians who have not yet done so to get vaccinated for the safety of yourself, your loved ones, and your community. COVID-19 has proven to be a stubborn enemy, and only through COVID-19 vaccination can we defeat this foe once and for all. And now we'll open it up to questions.
Thank you, Director Allen and Dr. Seidlinger. I'm seeing a couple questions in the chat to pin the speaker and grant recording privileges. So just making sure the team sees that as we proceed. Thank you so much. Our first question comes from Gary Warner with EO Media. Go ahead, Gary.
Hi, can you hear me? Okay. Basically, I wanted to ask if you're seeing a couple of things. First of all, you're basically asking for a voluntary action by county officials in areas that throughout this entire pandemic have not taken action. Why do you think they'll take action now? Why are you making a public request for them to take action when they haven't? What effect do you think you can really have through this? And secondly, you said 9 out of 10 of the people who are getting infected are not vaccinated. Have you seen any change in the 1 out of 10 or so, the people who are vaccinated, and increase at all in the number of breakthrough cases? That's it.
I'll tackle the first part of the question and maybe leave the second for Dr. Seidlinger. I think ever since the governor previewed the notion that she was going to be ending many of her emergency orders, I think we've been talking about the fact that like all other infectious disease outbreaks, that responsibility for responding to localized outbreaks would fall to local officials. And I think what we're trying to do is make sure people understand that the Delta variant is quite serious. It's playing out significantly in parts of the state that have low vaccination rates, and we need to make sure that people who drive local opinion in those parts of the states, people who live in those parts of the states, understand the gravity of the circumstance, and that in particular getting vaccinated is so critically important. But if people are going to continue to choose not to be vaccinated, they really need to follow the recommendations that are being made by absolutely everybody, by OHA, by CDC, World Health Organization, that people who aren't vaccinated should be wearing masks and staying socially distant, because this this Delta variant is multiples more contagious than previous versions of the virus, and it's really a serious issue.
And thank you for that second question. You're right that 9 out of 10 of the deaths were in people who are vaccinated, and only 9 out of 10 of the deaths were in people who are not fully vaccinated. So about 10% of deaths were in those who were vaccinated. These individuals tended to be older and have many underlying medical conditions that likely contributed to their deaths. As more people get vaccinated, we will see the number of cases, the number of hospitalizations and deaths due to COVID go down, but we may see an increase in that percentage of folks who have breakthrough cases and deaths associated with COVID that have been vaccinated, because as more people are vaccinated, we will see a higher percentage of cases of breakthrough disease just based on the population that the virus is circulating in. But it will cut down on the disease overall, and we will continue, I think, to see that this is a disease that primarily impacts people who are not vaccinated. It primarily makes people who are not fully vaccinated sick. It primarily makes people who are not fully vaccinated be admitted to the hospital, and our deaths are occurring primarily in people who are not fully vaccinated. If you're vaccinated, you're very unlikely to fall into one of these groups.
Let me just follow up real quick on one thing and be very specific. You talked about Umatilla County and the problems that the percentages you're seeing out there. One of the biggest events of the year is the Pendleton Roundup, which is coming in September. If these numbers don't change, will the state step in and stop the Roundup?
You know, if we've learned anything in the pandemic, Gary, it's that 2 or 3 months in the future is kind of an eternity. So I don't want to try to speculate on what's going to happen between now and then. What I would really like to happen between now and then is for a much higher percentage of the residents of Umatilla County to get vaccinated than they are now. If that happens, that has all kinds of benefits that go with it, including not having to worry about trying to figure out what an answer to a question like that might be at that time.
Okay, thank you.
Thank you, Gary. All right, our next question comes from Amy Green with the Oregonian. Go ahead, Amy.
Hi. Yeah, I had a question about children infections in children or youth, 0 to 19 as OHA categorizes them. Can you describe to me what you think is happening with infections in children, why they're increasing so much faster in the past week than they have been for the general population of adults? Now, I'm not working off of today's numbers because I haven't seen them, but yesterday's numbers. Cases in the general population from last week to this week increased about 50%, and it was more than 100% for youth 0 to 19.
Sorry, Amy was finding my mute button. I think what we're seeing as cases increase, we're seeing cases increase across the age groups, but this hasn't been the same across all age groups. We know that children 0 to 12 are not yet, or children under 12 are not yet eligible for vaccines. And while we saw a tremendous vaccine uptick amongst those 12 to 15 when the vaccine was opened up, and we have fairly good vaccine coverage amongst the children who are eligible, this is overall a population that is not yet protected with vaccine. So as they are in the community with these more transmissible variants, if they're not wearing masks and not taking other steps to limit some of their higher risk indoor gatherings or gatherings in outdoor crowded places, they will be exposed to the Delta variant, and this Delta variant is much more transmissible. So as a group of Oregonians who are less vaccinated, often because they are not yet eligible, we are seeing cases spread more quickly amongst this group.
Well, have you seen any specific outbreaks? Can you speak to any specific outbreaks? Do you think it's summer camps that the kids are going to more often? And second part of this last part of the question is, I know the governor is recommending masks in school for unvaccinated people, children. But would you recommend, are you thinking of recommending anything stronger than that to the governor, like saying, hey, we have to go back and require, given the Delta variant and given what you had just said, Dr. Seidlinger, about unvaccinated people in low vaccination places getting the Delta variant? And I've also heard federal officials saying everyone who's unvaccinated should expect to get the Delta variant. Are you thinking about recommending to the governor that we go back and require at least unvaccinated kids to wear masks 12 and under, which is all of them?
I will say that the cases we're seeing in kids aren't directly tied to one large outbreak. We haven't seen some of the large summer camp outbreaks that have been reported in other parts of the country, but it is very possible here. If the summer camp is a place that has unvaccinated children and they're not taking precautions, such as encouraging or requiring masks indoors and not limiting some of the gatherings amongst those high-risk people. The cases we're seeing amongst children are occurring across the state and through various kinds of transmission within their household from other family members. We're not seeing the school outbreaks anymore now that schools are not in session, but in other places where kids get together, we have been seeing some outbreaks, but not one or several large outbreaks that are driving this increase in cases. As for recommendations for masks in school, OHA and ODE, in alignment with our federal partners, strongly advises the use of masks in schools. The CDC recently updated their statement to say that masks should be used by individuals in schools who are not yet fully vaccinated, and we're looking at that guidance to see if we need to change ours. The decision to require masks, again, relies with those local decision makers. As Director Allen stated before in his answer to the Pendleton Roundup question, predicting the behavior of COVID-19 a month, 2 months, or 3 months into the future isn't possible with the way this virus has changed, the way transmission has changed. But at this time, based on the recommendations that we have, we're encouraging local school boards to do what they can to assure that people are wearing masks appropriately in schools to prevent the spread of disease. This is especially important in elementary schools where those students are not yet eligible to receive the vaccines. So mask use remains the most effective tool we have to prevent spread in those settings. Physical distancing has been shown to not be as critical. So we encourage schools to bring all students back into in-person instruction, but do so with layered safety measures in place that focus on ventilation, mask use, and vaccination for those students and staff who are eligible.
Thank you.
Great, thank you, Amy. Our next question comes from KPTV, Fox 12, Simon Gutierrez. Go ahead, Simon.
Sorry, just had to unmute there. Is there any evidence, this is probably for Dr. Seidlinger, but is there evidence at all, to your knowledge, that the Delta variant is more likely to infect younger people? I've heard something to that effect published nationally, but I haven't heard anything concrete. Do we know anything more about that?
I don't think that we have data that shows that younger individuals in and of themselves are more likely to be infected with the Delta variant. The Delta variant in studies has shown to have people infected with the Delta variant tend to carry more virus in their noses. And we think that may be contributing to why it's so much more transmissible. And children under the age of 12 are not yet eligible for vaccine. And in many cases, adolescents who are eligible for vaccines have lower rates than, for example, seniors and some older adults. And so I think what's driving the increase in cases and some of that association is likely that this is a population that is less likely to be vaccinated, but the Delta variant is very likely to infect you if you come into contact with someone and you're not yet fully vaccinated, or if you've been vaccinated and you're immunocompromised and the vaccine may not offer you full protection. This variant is very concerning. When we talked about the Alpha variant that came into Oregon over the winter, that was 50% more transmissible than what had been circulating in Oregon. And this Delta variant is 50% more transmissible than that. So it is very easy to get infected with COVID-19 if you come into contact with someone with COVID-19 if you're not yet vaccinated. And I think that's what we're seeing in kids, and that's what we're seeing in parts of the state where rates are higher, where vaccinations are lower.
Thank you, Dr. Seidlinger. Our next question comes from Southern Oregon, KDRV Newswatch 12. Go ahead.
Thank you. Hi, this is Mike Sakino. This is for Dr. Seidlinger. Doctor, I'm noticing that breakthrough cases seem to be on the rise, a steady increase. Of those breakthrough cases, and I know you said that as more people get vaccinated, we should see more breakthrough cases, but with this virulent Delta variant, is that impacting more breakthrough cases? In other words, are you seeing the Delta variant as the predominant variant in breakthrough cases?
So while we are able to sequence some of the cases, some of the virus from breakthrough cases, we're not always able to get a sequence on all of it. But we are seeing variants of concern, including the Delta variant associated with breakthrough cases. And as the Delta variant has now surpassed 50% of recent cases identified in Oregon and is expected to continue, I expect that we'll see more of our breakthrough cases associated with the Delta variant. The Delta variant is much more transmissible for everyone, but that's primarily those who are unvaccinated who are impacted by this variant. They are more likely to get sick, be hospitalized, and die. But as we have fairly high percentage of vaccinated people, and as Delta becomes the most common virus circulating here in Oregon of the COVID variants, we are going to see more of our breakthrough cases likely associated with Delta.
All right, and I have one follow-up question, and that is, when we see statistics of the state where it says 97% or 99% of the positive cases and 94% of hospitalizations are from unvaccinated individuals, does that mean that the percentage that is remaining are all people who have been vaccinated, or can it be a list of, are there unknowns?
Sure, for that high number of folks, those are folks who are not yet fully vaccinated. So those are fully vaccinated individuals are 2 weeks out from their final dose, 1 dose of Johnson & Johnson or 2 doses of Pfizer or Moderna. So as you stated, about 10% of our deaths are in folks who are fully vaccinated. The rest are in folks who've either received 1 dose or are not out from their 2 weeks, and most have not been vaccinated at all. Occasionally, we do not know vaccination status, but we go through with all of our cases and we try to identify if they've received vaccines recorded in our immunization service. We do this for all cases to match them up so we can get the best picture of their vaccination record so that we have minimal missing data.
All right, thank you.
Great, thank you, Mike. And our next question comes from Tatiana with the Register Guard. Go ahead, Tatiana.
Sorry about that. Can you hear me?
Yep.
Okay,
And
great.
now, go ahead.
My question is OHA concerned about the vaccination rate among healthcare workers? There's no way to make the healthcare workers get vaccinated in Oregon, as we know from previous reporting from different outlets. So I'm wondering if OHA is considering any other tactics to try to get this demographic vaccinated.
Thank you, Tatiana. I think we're always concerned when we see pockets of people who are vaccinated at lower rates than others who are unvaccinated, and particularly in a population like healthcare workers or those healthcare workers who work in long-term care facilities who have multiple exposures to individuals who are sick, multiple exposures to individuals who may have more severe complications from COVID. So we've been working with our healthcare partners to encourage vaccination, ensure that people have the time off and have easy access to vaccine. Many employers have offered on-site vaccination, offered that time off for individuals, including time off for those who may have side effects after the vaccine, so that they can remove those barriers. We've been providing information, educational information about the importance of getting the vaccine to protect the healthcare workers, the families that they return home to, as well as the patients they care for. You're right that a tool available to other businesses in Oregon is not available to healthcare employers to require vaccination, but certainly our healthcare employers, our public health departments, our community partners have done multiple other things to get the word out, provide information about vaccines, and to provide ready access to vaccines for these this workforce who is more exposed to the virus and is more likely to pass it on to others. So we work in multiple channels to try and encourage vaccination in this population, even though one of the tools is not available to us, which would be a vaccine mandate for those employers.
Thank you, Tatiana. Our next question is from Lynn Terry with the Lund Report. Go ahead, Lynn.
Thanks for taking my question. I just want to have a follow-on to that last question. It's my understanding that OHA could come up with a ruling that would permit healthcare organizations to force their employees to be vaccinated. Why is OHA not considering this?
Yeah, we have actually a slightly different understanding of our authority. It's not that we have the authority to adopt a rule that would permit organizations to require it. It's that we have the authority to require all organizations to require vaccination, and we think that's an entirely different thing. Circumstances vary across different, not just categories of healthcare worker, but different parts of the state, different employers, those kinds of things. And I think one of the things we're concerned about is doing something sort of in an across-the-board mandate, whether a particular business feels like it needs it or not, and having a big impact on the healthcare workforce, which is very fragile right now. People have been working really hard across the healthcare systems for going on a year and a half now, and we've got challenges being able to keep all kinds of facilities functioning the way they need to based on staffing. And so at this time, we would be reluctant to mandate all healthcare providers or entire categories of healthcare providers require vaccines for that reason.
I wanted to ask something that's never discussed. I'll back up just a little bit, and that is that the messaging coming from OHA with the Delta variant is very similar to what we heard earlier about the Alpha variant. And I'm just thinking that people who, are skeptics, and kind of poo-poo the whole pandemic, I'm just wondering if using the same kind of messaging, well, here comes the Delta variant, it's really more serious, you need to get vaccinated, why that messaging, I mean, this sort of follow on to what Gary asked, but why this messaging would work, A, and combined with that, I'm wondering why, nothing's said about long COVID, which is a very scary thing. I mean, that's what I'm scared of, not dying, but getting COVID, long COVID, and then you're sick for the rest of your life. So if you could address that, it would be great. Thank you.
Sure, let me take a crack at it and maybe invite Dr. Seidlinger to add on as well. I think throughout the pandemic, I think at the Health Authority, we've tried to have our messaging be, here's what we know about the facts, here's what we don't know, here's what we believe is going to happen, here's what we think the consequences of that will be, and try to have our, quote unquote messaging be what we think the facts are and how we interpret those facts and what we think people ought to do based on those facts. And I think that's a pretty reliable way for a public agency to try to message. I think you raise a really interesting point about long COVID. We have tended to talk more about, I guess, short COVID, because it's so much more common, and the effects are hospitalization and potentially death. What I don't know, and perhaps Dr. Seidlinger does, is sort of what's the extent of long COVID, and perhaps more discussion of that might be helpful. I think it's a good point. Dean?
Thank you. I think, as we continue to learn more about COVID in general, the disease known as long COVID or post-acute COVID-19 syndrome is an area that we know even less about. I think we're learning more as our academic partners and healthcare partners are treating patients and following them over time to see what the long-term sequelae are and what's the actual percentage of people who have these types of symptoms that afflict them and for how long. There's been some data that's looked at, a subset of 50% of some hospitalized patients may still have symptoms in the weeks following their discharge, but we don't yet know the full extent of that. But what we do know is that if we can prevent COVID-19 infections, we can prevent the long-term sequelae as well. And the vaccines we have seem to be very effective at preventing, or are very effective at preventing COVID-19. There's some initial data that shows that they may also be effective at preventing or improving long-term COVID symptoms in those who have them, but we don't have those definitive answers. So we, await for studies that are coming from our academic and health partners in conjunction with public health to see what are these long-term effects, how many people are they impacting, and how long do they last.
And I'm also reminded that we have featured one or more long COVID patients at press conferences previously, but Lynn, to your point, it's not been a regular part of our messaging.
Thank you, Lynn. Okay, our next question is from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hello. So vaccinations, like growth in vaccinations, is essentially like plateauing. Like we're not seeing a substantial rise at this point. So is there anything really that OHA can do or is considering doing that would change that trend? Like at this point, are there other tools that you guys have? And if not, how realistic is it that Oregon will ever reach an 80% vaccination rate?
Well, I think I would not, maybe we're using plateauing differently. I don't know that I would agree that we're plateauing. I think certainly the rate of increase is slowing, but we're getting, 2,000 first doses a day right now. And, I would point to growth rates of vaccines amongst seniors. Every single week, we're adding 1/10 or 0.2% to seniors who've been highly vaccinated for a long period of time. So I do think it's realistic for us to get to an 80% level. I think it's going to take some time. There are ways that dynamics will change. Anecdotally, I've seen stories that in other parts of the country where Delta variants have taken off even more significantly than they have here, that has caused a corresponding increase in interest of the vaccine, particularly in areas that are suffering now a lot of COVID infections, and they really, I think, maybe more directly see the impacts of what not being vaccinated does. I think there have been some reports of some changes in some media circles, in some houses of worship communities, those kinds of things where some of the messaging to encourage vaccinations is changing. And I think that could have an impact as well. So I think is there some kind of a tool in the toolbox that we've been holding out on and not using that we think will have a big impact on increasing vaccinations? No, there's not. But I think circumstances in the community can change. And I think that's why we continue to try to make as much information about vaccination and the impacts of non-vaccination as widely available as we can.
I think just to add on that, we're not going to see vaccines increase the same way we did at the beginning of the pandemic. Like it would be hard for us to hold a mass vaccination event right now and see, 5,000, 6,000 people show up and get vaccinated. The vaccination efforts take more time, often take more outreach and education from trusted folks in the community. So making those linkages, making sure the vaccine is available in a convenient location is very important. But we have additional tools, such as what Director Allen mentioned, with kind of doing some canvassing in neighborhoods with lower vaccination rates and in communities with lower vaccination rates to try and make sure we can get to people where they live, where they spend the most time, and get them the information and get them linked up to a vaccination effort in their community. So these vaccination efforts are slower than some of those early mass vaccination efforts, but we continue, as Director Allen said, to see a couple thousand people initiate their vaccination series every day. And we hope to see that uptick some, but we won't likely see dramatic increases in that.
If I could ask just a follow-up. So do you plan to recommend that employers mandate employee vaccinations as a condition of work? Why or why not?
Well, right now,
I think what we've done, go ahead, Pat.
I was saying, right now, all employers other than healthcare employers can already do that. And so I don't think we have plans At this, I would say we don't have plans at this time to require employers to do something that they're already able to do. And we've already talked about the healthcare lockout circumstance, and I don't think I have anything to add there.
Well, I mean, will you recommend or urge that employers do so, that they mandate that their employees get vaccinated?
Well, I think maybe a step short of that. I think we strongly encourage employers to facilitate their employees getting vaccinated, to hold employment worksite-based vaccination clinics, to provide time off for side effects, those kinds of things. And many employers have done that, and it's certainly an effective tool. We don't have plans at this time to require them to mandate vaccines.
But I'm really sorry to just follow up, but why are you stopping short of recommending that they mandate? Recommending as in they have the choice, but you tell employers, hey, we think you guys should mandate that your workers get vaccinated.
If I'm following what you're saying, I think the challenge we have is we have high vaccination rates already in places where populations are well disposed to get vaccines. We think in places where the population, where vaccination rates are low, that persuasion and information from trusted sources is likely to be a much more effective way to get people vaccinated than someone saying, I don't care what you think, you have to get vaccinated. I talked earlier about some media outlets changing their position on vaccinations, some faith communities changing their positions. I think those kinds of channels, I think conversations with healthcare providers are all likely to be much more effective in persuading people to get vaccinated. And I think, again, back to the example of what's happening in other parts of the country with Delta, seeing much more right out in front and visible the impacts of not being vaccinated and how they differ from places that are vaccinated is more helpful. I'm very concerned that simply a direct order right now, given the highly political nature of COVID itself and the vaccines particularly, I think is not likely to be a highly productive tool.
Thank you.
Thank you, Fedor. Our next question comes from Amelia Templeton with OPB. Go ahead, Amelia.
Yeah, I'm wondering if there are any state Republican leaders who are helping you champion vaccinations, county commissioners, state legislators, mayors, anyone else who has been doing outreach to their fellow partisans, given how politicized the issue is.
I've had a number of conversations with various county commissioners, other local leaders. I think it would be better to let them speak for themselves in terms of how they're advocating in their communities. But I think across the board, there are political leaders who are interested in what they can do to help provide good information to their constituents about the value of getting vaccinated.
Have they told you that they don't wish to be publicly named as vaccine champions, or that it's not helpful to have OHA publicly commending them for their work?
I would not say that I've had exactly that kind of a conversation with that language. I think I've had lots of candid conversations about in various communities who are the right messengers and what's the right message. And I would go back to, I've said a couple of times, healthcare providers and houses of worship and friends and family really are much more effective messengers in a lot of places than government agencies or politicians or movie stars or athletes for that matter.
Last question, different subject here. Are you tracking how close counties are to herd immunity? Not just the vaccination rates county by county, but your estimate of how many people have been infected. It seems like with the Delta variant and just how transmissible it is and how quickly it spreads, that I guess I'm wondering if some counties are going to tip over into herd immunity through natural infection and vaccination combined.
I will say, I think, we've been done a good job as a state of having fairly low COVID-19 infections throughout this pandemic. And certainly there have been parts of the state that have had higher numbers of infections, higher case rates during the surges that we have, and are being more impacted now by this increase in cases from Delta. And certainly we know that at least for the short time that those individuals likely are protected from COVID. We don't know how well natural immunity will protect them from variants that they weren't infected with. We have more data on that from vaccinations, and getting vaccinated comes without the potential for hospitalization and death that infection comes with. So certainly I think as we see increased cases in some of these counties, that will help contribute to slowing the spread, but it comes so at a huge cost. And even those individuals and studies have been shown that as someone who's recovered from COVID, when they get a vaccine with COVID, their immune response is very strong, indicating that that vaccine offers them some additional protection that just having recovered from COVID doesn't offer.
The only thing I would add to that is I think we are challenged by the fact that we have never been able to identify 100% of every case, and so our base for our database for what's the percentage of populations in each county that have been exposed is significantly incomplete. It's hard to pin down even at the statewide level, and harder at the local county level to know what an exposure rate in a given county is.
Thank you so much, everyone. It's 8 after 3, and we are going to wrap things up. I see there were a couple additional questions added into the chat. We'll get back to you, Lynn and Gary, with answers to those follow-ups. And as always, to our media partners, remember, we've got that Oregon COVID-19 media email, orcovid19.media@dhsoha.state.or.us. So send any follow-up questions that perhaps we didn't get to today our way, and we will do our best to answer them. I want to thank Director Allen and Dr. Seidlinger and all of you for tuning in today. All of this will be available in the daily media release released here in just a little bit, so stand by for that. And thanks again for joining us. Have a great day.